We're going to look at a banded mobilization to facilitate more upward rotation of the scapula, which is needed to achieve full shoulder flexion. Now, in the cases where people have kind of a painful shoulder when moving overhead, usually there's some faulty scapular mechanics happening there, and this technique can help significantly improve range of motion pain-free before your training. So we're going to take a heavy band, step on it, loop it around the shoulder to where it's just right next to your neck. Okay, so what this band is doing is it's causing the superior angle of the scapula to depress, which allows the inferior angle to kind of abduct and move into upward rotation when we're moving into shoulder flexion. And just this motion alone should feel a bit less restricted. Now what we can do, we can of course move through the ranges here actively, but what we can do to spice this up and to actually get a little bit more traction in the shoulder and stretch the lats is go into a banded lat stretch along with this. So we'll loop the band around the hand, we'll step back so that line of pull is still going directly down. And now from here, we'll round the spine because the lats insert into the back of the pelvis here. So we want this spinal flexion. Okay, so I can squat into it a little bit. And now I can rotate my other hand through. So we're really getting that good lengthening here, allowing the band to pull the arm more overhead. We can contract, relax here, pulling down on the band. Inhale. Relax. I can try to sink my hip down further toward the ground. We can kind of just push into more overpressure into shoulder flexion, kind of dynamically. And then dismount, and that arm should feel much more comfortable going overhead. Now realize this is a passive mobilization, so it's not going to lead to a ton of long-lasting gains if you don't train this range of motion after. So maybe making sure that the lats and shoulder extensor muscles are getting strong eccentrically through full range of motion with other exercises, as well as facilitating more strength through some of the muscles that upwardly rotate the scapula, like the serratus anterior and lower trapezius muscle. So hopefully that helps, and give it a try.